write here some principles. So clotting time, that is thrombin time, is inversely proportional to the levels of fibrinogen. This is the statement. The higher the thrombin time, the lesser the fibrinogen levels. So this is one principle. So next one, normal values of fibrinogen. The normal values of fibrinogen are 200 to 400 milligrams per deciliter. 200 to 400, very Shubham? Does it? Milligrams per liter. Not deciliter, liter, okay? Per liter. Okay.
Sir, what is the principle? What is the principle?
Principle I will discuss later. Just keep in mind, increased thrombin time is inversely proportional to reduced fibrinogen levels. That I will discuss. What is it? That is today's text actually. So before discussing about these things, first we need to understand the significance of fibrinogen. What is the significance of fibrinogen? Yes, Mr. Akshay. Yes.
To the level of thrombin type is inversely proportional to the level of.
Yes.
Sir, मैं कुछ और बोलना
Listen, fibrinogen is secreted by liver. Fibrinogen is secreted by liver. Okay. So then, coming to the fibrinogen, what is the use of fibrinogen? For clotting, right? So yeah, fibrinogen will be converted to
fibrin
and fibrin will lead to clot. Very good. So that we know. Then you need to know coagulation pathway also. So a quick review of coagulation pathway. So this is blood vessel damaged. Okay, and here tissue damaged. Okay, so when the blood vessel damaged, what pathway will be initiated? This will be intensive pathway. And if tissue damage, what pathway will be initiated? Extrinsic pathway. This you know. So both of the pathways will prepare a common substance, that is prothrombin activator. Prothrombin activator. Right? So what is the use of prothrombin activator? It will convert thrombin to
thromboblastin.
Prothrombin to thrombin. See, when I am writing mistakes, you are thinking that is correct. Prothrombin to thrombin, right? Now this thrombin, what is the use of thrombin? Thrombin will convert fibrinogen to fibrin, and fibrin leads to clot. So that we know, right? Then, so if I want to measure fibrinogen levels indirectly rather than directly detecting fibrinogen, the problem with directly detection of fibrinogen levels in the body was we need to opt some of the lab tests that will be done in biochemistry, especially electrophoresis. Okay, electrophoresis is a costly method. This will cost around 1500. Okay, or we can use other chromogen techniques such as ELISA, again a costly technique, or we can also use other similar techniques. Okay.
Sir, PCR कर सकते हैं?
Radio immunoassay, etc. Okay.
PCR कर सकते हैं?
What?
PCR.
PCR is for genes. This is a protein. Fibrinogen is a protein. Yes. Okay. So let us focus on here. Then after clotting, what happens next? Fibrinolysis happens, right? Fibrinolysis happens. In fibrinolysis, what happens? Tell me students, fibrinolysis. Here I wrote fibrinolysis. Fibrinolysis leads to, it will make two types of byproducts. They are fibrin degraded products, pieces of fibrin products, and other one, D-dimer molecules, D-dimers. Clear? That's it. So now you know what is coagulation, what is fibrinolysis and fibrinogen. Then I will give you a case study here. Reduced fibrinogen levels. Reduced fibrinogen levels. So before that, I will add one more point. So types of clotting conditions in the body. Types of clotting conditions. Broadly, there are two types of clotting conditions. Keep in mind. There are two types of clotting conditions: acute and chronic. One example of acute. One example for acute. Suddenly your blood started clotting. Is it possible? In what condition suddenly the blood started clotting? Poisons. Very good, Mr. Shubhi. Poisons. Very good. Venom. I will write snake venom. That's how snake venom works actually. Okay. Snake venom has a very powerful coagulants. They will clot the blood actually. Okay. So snake venom will be an acute clotting condition. Then any other medications? Okay, that is possible. Medications. Any more? Okay, they are like acute. Then can you give examples of chronic clotting conditions? Hemophilia. You know, don't confuse hemolysis with clotting. This is not about breaking down of blood. This is about clotting of blood. Yes. Hemolysis won't cause clotting. It will shoot up the bilirubin levels. That's not the case. Yeah. Yes. Thrombocytopenia. In thrombocytopenia, blood won't clot at all. I was discussing about clotting condition. Increased platelet. Very good. Purpura. Purpura is one answer. Very good. Yeah. In purpura, what happened was, Shubham came close, but wrong answer. Platelets will be abnormally activated in the body. Platelets activated and they are clotting blood. That is why purpura happens. Okay. Then, so this is not a single or a sudden attack. Sudden purpura. Purpura takes a long term. Platelets are gradually, malfunctioning in the body. And there is a deadly consequence of chronic clotting. What is the condition? When the clot is present in the multiple blood vessels. Disseminated intravascular coagulation. Very dangerous condition. Now the blood started clotting in the multiple regions of the blood vessels. That is called as DIC. A purpura can lead to a DIC in long term. But my point, purpura can become a DIC. DIC is very dangerous.
So what happens in DIC?
What happens in DIC? I will tell you in a very simplest way. You have blood vessels, we have blood vessels in the eyes, and imagine blood vessels are blocked. Some blood clotted in the blood vessels, now you can't see. What? Imagine blood vessels clotted in the heart. You will get ischemic heart attack. Ischemic heart attack. Deep vein thrombosis. Yeah, deep vein thrombosis is a clinical form of DIC only. Deep vein thrombosis, yes. Deep vein thrombosis is a dangerous condition. If we are not treating deep vein thrombosis, there is a chance of gas gangrene formation. Gas gangrene formation means the blood flow to the limbs will be stopped, and we need to amputate the limbs. Any more? Deep vein thrombosis, these things are clear. Is everything clear so far? Yes. Chronic clotting conditions, acute clotting conditions. Then I discussed about these things. Now, I want to discuss about fibrinogen levels in these two conditions. Fibrinogen levels. what we assume the normal fibrinogen levels are 200 to 400. When there is a severe clotting condition going on in the body, what happens to the fibrinogen levels? Fibrinogen levels, in case of acute condition, they will be reduced because fibrinogen was converted to fibrin. It is converted to fibrin. So fibrinogen levels will be reduced in a severe clotting condition. And also, patient has purpura. If purpura, where there is a very severe DIC, very severe DIC in the body. Severe DIC means so much clots in the body. Then what will be the fibrinogen levels? They will be drastically reduced. Fibrinogen levels will be reduced in DIC condition. Now, should we trying to state a point? In case of chronic conditions, the fibrinogen levels might be increased because it is overutilized. Now the body is negative loop, just like bone marrow. In case of hemolysis, what happens? Bone marrow will pump more red blood cells, more than its capacity. Similarly, the liver can compensate the DIC with increasing the fibrinogen levels. We are not worrying about the chronic clotting issues. We are worrying about either DIC or acute clotting conditions. In case of severe DIC and acute clotting conditions, the fibrinogen levels will be drastically reduced. Okay, so this test is primarily focusing on reduced fibrinogen levels. This test is particularly measuring reduced fibrinogen levels. This test won't care about increased levels. Increased levels we can check with other biochemistry tests. This test is particularly checking the reduced fibrinogen levels in the body. Is it clear? Yeah. Now, is there any non-clotting related reduced fibrinogen level condition in the body? That is my question. Without severe clotting, can the fibrinogen levels reduced in the plasma? Got my point? Very good, Shukri. Very good. What if the patient has a liver issue? The liver was failed. Liver failed, maybe due to severe alcoholism or due to hepatitis A, B, C, or any drug intoxication. Sometimes drugs will interfere with liver activity, like chloroquines used in malaria infection.
Also affect. Diet will also affect.
Diet?
Yes, sir, like junk foods and all.
Yes, that's a chronic condition. Yes, diet and diet and drugs. Okay. Even in case of liver failure, definitely the fibrinogen levels will be reduced. But the liver connected fibrinogen can be detected with multiple easy tests like bilirubin test. That is sufficient. Bilirubin or jaundice, typical jaundice symptoms can be seen in the patient. Stomach pain, yellowish eyes, a lack of appetite, these things. So, liver mediated fibrinogen levels we can directly detect without this test, that with bilirubin test or symptoms of the patient. Okay, so I eliminated liver correlation with fibrinogen. We are only focusing on reduced fibrinogen levels due to clotting in the body. Clear? Yeah. So this test, then yesterday Muska was really concerned between the difference between thrombin time versus Claus test. This is Claus test. What Claus test states was, listen here, we know that fibrinogen will be converted to fibrin by thrombin. If I want to measure the fibrinogen levels, I can take the thrombin time, and thrombin time will indirectly determine the fibrinogen levels. How? I will discuss. I will take excessive thrombin reagent. The ratio, listen, normally the ratio between these 50% fibrinogen and 50% thrombin. Okay. Now let me flip the story. In case of reduced fibrinogen levels, this will be 10 and 90. What happens in this case? The thrombin time will be, or simply in this condition, the thrombin time will increase because reduced fibrinogen levels. Due to reduced fibrinogen levels, the thrombin time will increase. This is what happens in DIC. In DIC patients, already the fibrinogen is less. So when we measure the thrombin time, it will be elevated. Elevated thrombin time is an indirect indication of reduced fibrinogen levels in the body. Got my point? How? In a healthy patient, thrombin time will come as a normal in healthy patients because they have 50-50 ratio. 50% thrombin, 50% fibrinogen. Now, in my case study, there is a reduced fibrinogen. When fibrinogen reduced, automatically this levels looks heavy. 9:1 ratio. The ratio altered because this one reduced. These levels were reduced less than 200. Huh?
These are the reduced. One is reduced, the other one also affected.
So when I was measuring this one, definitely I will get yes, they are connected. Definitely this level will be increased in decreased fibrinogen condition. That is the idea of the test. Okay. Then Muskan asking me a question. Why don't we do directly a thrombin time to measure fibrinogen levels? Why we opted the second test? Now listen. What Claus did was, there is an issue with this test, that is inhibitors. There are certain inhibitors in the body. Okay, if you remember the theoretical classes, D-dimer can also act as an inhibitor of fibrinolysis. Okay, these inhibitors will interfere with the thrombin time and we will get a false normal values in the patient. D-dimers will suppress the clotting and we will get a normal values because of D-dimer activity. Because of inhibitors, I need to remove inhibitors from the sample. How I can remove inhibitors? I will dilute the sample. First I diluted the sample, serial dilution I have done. So dilution will minimize the inhibitors concentration. Inhibitors concentration reduced by dilution. Plus I will use a high concentration thrombin. Purposefully I am using a heavy concentration of thrombin. So that will suppress other inhibitors. That is the idea of Claus test. I will use 100 international units of thrombin as an activator in Claus test. Why I am using heavy thrombin? Because I cannot rely on body's thrombin ratio. This normal thrombin present in the body might be suppressed by inhibitors. So let me take an increased thrombin, extra thrombin, heavy thrombin concentration with a diluted sample to get the right value. Got my point? Why I used heavy thrombin? Because normal body's thrombin might be suppressed with body's inhibitors. So to increase the sensitivity of this test, I have used an increased thrombin, heavy concentration of thrombin. Also, I diluted the sample. Hence, the formula. Increased thrombin time is inversely proportional to fibrinogen levels. The lower the fibrinogen levels, the higher the thrombin time measurement. That is Claus test. That is all about Claus test. So yes, Claus test is a modified thrombin time actually. This is a thrombin time test, but there is few modifications of diluting the sample and increased thrombin concentration in this test. So how we will perform this test? Very simple. You need to take, can anyone guess what type of sample we will take for clotting studies? Obviously anticoagulated sample. What type of anticoagulant we are using? We are using citrate. Citrate is the ideal anticoagulant. And what proper sample we will take? Any idea? Platelet pool plasma. Citrated platelet pool plasma will be taken for this test. Citrated platelet pool plasma will be taken. Now to this test, we need to add an activator. What activator we are using here? Thrombin. So I hope you understood why we are using thrombin as an activator. Because thrombin will initiate this reaction. Conversion of hydrogen to fibrin. So how much thrombin we are taking? 100 international units of thrombin will be taken. That means extra levels of thrombin has been taken. Okay. Face mask and head mask. Okay. Yeah. After addition of thrombin, what we will do? We will go for measuring the time it took for the we are measuring the thrombin time. That's it. Plasma maybe you take 1 ml, 1 ml and this will be. I need to check the material how much they are taking. Let me see. 1 second. 200 microliters of we are taking 100 microliters of plasma. To it we are using 50 microliters of thrombin. This is the reagent. 50 microliters of thrombin to the 100 microliters of plasma sample. Yes. Any doubts? 100 microliters sample, 50 microliters plasma reagent. Okay? Yeah. Then what else? What? Very good. I follow this point. This is a quantitative test. This is a quantitative test. Quantitative test, not qualitative. Actually, yesterday I started this lecture with quantitative and qualitative. Actually. Yeah. What is the difference between qualitative and quantitative? Tell me, students. In qualitative, we will know whether it is present or absent, positive or negative return. But in this test, we don't want its presence or absence. We need its levels. We have to measure the levels to identify the issue in the body. Got it? So yes, this is a quantitative test. This is a quantitative test. And now, can you think in the I got a patient with a DIC. I know that my patient got a DIC. He got a multi-clotting. He got a ischemic heart attack. He got heart attack. He came to my lab. Now what the doctor did was, doctor kept the patient under warfarin therapy, or he kept him under heparin therapy. During heparin therapy, we need to assess whether heparin dose. We need to check the dose, very critical. Dose is very important. Dosage will be determined based on the level of clotting in the body. So the level of clotting, we already got by DIC. Before giving heparin, we got the level. So it very heavy elevated clotting type. That means there is a heavy clotting in the body. So according to the Claus test levels, we will determine the dosage of anticoagulants. Okay. Now we are giving anticoagulant and I need to measure my anticoagulant therapy in the patient. Whether my anticoagulant is working in the patient or not. Got it? Before treatment, I conducted a test. With this test value, I understood how much I need to give to the patient. I mean anticoagulant. After giving anticoagulant, I need to measure his activity. Again, I will take a sample. Now, in heparin therapy patient, what will be the levels of TP? That is my question. In anticoagulant therapy, what will be the levels of Claus test? Even I was a little bit confused here. Yeah, very good question. Previously I was confused how they are reduced. In anticoagulant therapy, the TT value will reduce. You understood why, right? In heparin therapy, the Claus test or thrombin time will be reduced. Why? Inversely proportional. Very good. Now the fibrinogen levels will increase slowly because the utilization of fibrinogen reduced, so levels are increased, so TP will be reduced. Inversely proportional. That is what inversely proportional is. If this improves, that will reduce. If that is reduced, this will increase. Got my point? Yeah. Why the hell we are doing this much complicated test when we have a direct fibrinogen assay? What is the reason? Cheap. That's it. So this will cost 2,000. Thrombin time will cost not more than 50 or 100 rupees. That's it. Always cheap, easy, simple and effective test. Yes, there is an issue with thrombin time. Again, Claus test has its own problems. This will be given false positive results in case of leukemia. If patient has some cancer or lipidemia. Fibrinogen looks very similar to lipids. If patient has excessive cholesterol, this test will come as a elevated TT. Got my point? If patient has more cholesterol blocked the heart, but we suspected it is DIC condition. Even cholesterol will cause pulmonary heart disease. Do you remember? Cholesterol will block the blood flow actually. So yeah, so we need to cross-verify with differential tests. Purely based on TT Claus test, we cannot determine DIC. We need to do parallelly other tests also. If Claus test came excessive, if there is an elevated Claus test, we need to parallelly check the lipid levels in the body. If lipid levels are normal, Claus test is increased, this is a DIC condition. Got my point? Yeah. So ideally this is not a gold standard technique, but this is the most commonly used test to identify DIC. So that's it. So imagine we got a patient, a farmer came to the lab, suspected a poison. Okay, it can be a scorpion bite or it can be a snake bite. Immediately what test we will perform? We will perform coagulation profile. We will go with PT, TP, TGT, CT, BP, then we will go for Claus test also to determine DIC in the body. Okay, so coagulation profile tests are very important among suicidal cases. I mean among poison cases. Got it? Yeah. That's it. That is all about Claus test.
Which condition is more dangerous, clot in the body or bleeding, continuously bleeding, like hemophilia or
Oh, very good. So now you're asking which is more dangerous, internal bleeding or excessive clotting. I will say both are dangerous actually. Internal bleeding also equally dangerous. Both are equally dangerous.
Sir, in both the cases.
But I can say DIC is more dangerous. Clotting is more dangerous than bleeding. At least bleeding we can stop with some medication, but clotting, that's a game over. The chances of saving the patient is very less once his blood is clotted. Yeah. I saw a very interesting case study. I was uploading one case study every day. If you are seeing in my YouTube, I was going through one material in one test book. I have seen a case study where a dead body. The patient was declared dead 6 hours ago, but once they started an autopsy, he was bleeding. Okay. Usually in dead bodies the blood will clot. Why he is bleeding? Can anyone guess? First of all, I was surprised and scared, but I understood the reason. That patient having a disease, by the way. Any guesses? We got a dead body. We assume that this is dead and we won't get bleeding. So we started cutting the body and there is a severe bleeding, just like a living patient. So the autopsist, okay, he was scared that the patient was not dead, he might be alive, and he started performing autopsy. But he was dead, by the way. What happened in this case? Any idea? Why a dead body bleeding? Any more guesses? Yes, you are saying the answer, fibrinogen levels reduced. Any idea, any others? Hemophilia patient. He is a severe hemophilic. Okay, he is a hemophilia patient. So his blood not at all clotting, keep on bleeding. So actually this test is especially used to detect afibrinogenemia or I wrote two more lines. Write down these terms: dysfibrinogenemia, hypofibrinogenemia and afibrinogenemia. Dysfibrinogenemia means here the fibrinogen is present but this is not converting to fibrin. Dysfibrinogenemia, that means dysfunction of fibrinogen. And second one, hypofibrinogenemia, that means reduced fibrinogen levels. And third condition, afibrinogenemia. Afibrinogenemia means complete absence of fibrinogen in the body. Hypofibrinogenemia. Hypofibrinogenemia.
And third one?
Third one, afibrinogenemia. Complete absence of fibrinogen. Yeah. And I have seen one more interesting case study when I was going through one snake bite case study. There I saw what is that? Rhabdomyolysis. Rhabdomyolysis. Very interesting thing. Rhabdomyolysis. You know what is the meaning of rhabdomyolysis? This is a medical condition where the muscle will lyse. The muscles will be, the muscle will become juice. Keep in mind. So just imagine, rhabdomyolysis is a condition where the muscles will be disintegrated. You just imagine muscles disintegration means the strength of your arm, our strength came from muscles and they are disintegrating. Muscles are dissolving. And I came to know that there are some snakes, cobra, king cobra, and its smallest frog. This frog is there in Amazon. I forgot the frog. That is a blue color small frog. Looks very cute. But if you touch that frog on your armor, frog skin has mucus, and that mucus has a deadliest poison. That poison will, it will lyse the muscles. So you will feel it's a cute frog and you will keep on skin, but you don't know what you will undergo in the next night. Yeah, you will die. They say that this frog can kill 1,000 elephants with one exposure. If unfortunately an elephant, frog is there in the water, it was drinking water and frog entered into elephant, game over. An entire elephant will die in a matter of minutes. They are very dangerous toxins. Interesting things. Rhabdomyolysis. Yeah. So why I am telling this, because rhabdomyolysis can shoot up a Claus test, elevator Claus test. Yeah, that's it. Get ready for quiz. Any questions? Yeah, there is no other treatment rather than no continuous blood transfusions. What blood transfusion? We will take a healthy individual, we will separate fibrinogen and we will give that fibrinogen pure plasma. Very costly treatment. See, there are many medical conditions we don't know. We will think we don't know, but once you go to hospital, the things in the society are rare will become very common in the hospital. We will surprise. Yeah. Yes. Yeah, that's it. When I admitted Michael in PGI, we were there for 1 week, right? In the last day before we are discharging, they kept a new kid, maybe around 7 or 8 years old. He's a bald head, okay? They removed head. I understood what is the condition. And he has a cancer, a very severe cancer. I was sad. Yeah, that's it. That is medicine. Anyway, get ready for the quiz. If you think